Hi, Dr. Salil Khandwala from Advanced Urogynecology, and today we shall be discussing the testing and the urogynecologic evaluation. We talked about the importance of the history, examination, and now it'll be the testing. So the two main tests that we performed is one is called the urodynamic testing. So this is now typically done with the patient standing up, where we fill the bladder up and we have a pressure recording of the bladder, and we can identify exactly what is going on. So it takes about 10 minutes to perform. It is done in the standing position, but it gives us invaluable information about the strength of the urethra, the capacity of the bladder, when does leakage happen, what exactly is going on with the bladder pressures when leakage happens, what is the pressure at which a patient leaks when she is straining, and finally, how well does she empty? Does her bladder contract? Does her urethra relax? So what exactly is the mechanism of emptying the bladder? And finally, does she empty completely? So there's so many things that we learn in this one test. It's almost like, when someone complains of chest pain and you have no idea what is going on until you put an EKG on and you get that graphic recording and you realize that, wow, this is all over the place, as maybe a heart attack. So that is what this testing helps you with. So clearly helps us correlate what the patient's history is. Let's say she says, I leak when I cough, and now we can't find that. So maybe then she is waiting too long to go to the bathroom. Or if she's saying that I'm leaking when I'm rushing to the bathroom, so the immediate thought is that she has overactivity of the bladder. But when we do the test, it turns out that she has stress incontinence. Then in a woman who has a mixed bag, stress and urge, it helps us clarify, is it truly stress and urge, and the urodynamics will show that, or it may be only stress and there is no urge. So then it helps us institute the proper treatment. And it could be as simple as in the lady who just said that she coughs and we could not see it until about 300 ml or so. Just she has to just go to the bathroom a little bit more frequently. The second test is looking inside the bladder. She is also watching. It's completely under awake patient, and it takes just about maybe half a minute to look at it. And it is mainly done in patients with irritative bladder symptoms who are smokers or blood in the urine or previous surgery. So that's from the bladder standpoint. From the bowel standpoint, it's called anorectal manometry. It's a similar concept. It's the pressure recording of the rectal sphincter, and to see in what cases it's happening. Suppose if a patient has constipation or she has bowel leakage, it'll help us. We also do an ultrasound. As you can see, this sphincter right here is complete. You can see a complete circle right here also. You see this black circle? That black circle is that inside sphincter. This is the probe. This is the wall of the rectum or the anal canal. This is that black is the inside sphincter, and this white around there is the outside or the external sphincter. See, very nicely seen. Now see what happens when there is a tear. You can see that the sphincter is not there. You can see the probe again. You can see the inside wall right here, this white thing. The inside sphincter is this black, slightly weakened here, but the external sphincter only goes from here to here. You see? There is no external sphincter in the front, so it's torn, and that is what we will see in patients who have bowel leakage issues. So once the testing is done, then we also get a urine analysis. We make sure that in bladder leakage that a patient is emptying well, and we get the post-void residual bladder scan done, and we may sometimes send the urine for culture also. Once a detailed history, that's key, proper history that the patient gives us through the forms and the questionnaires, we review it, we go back and forth, ask some pertinent points, assess her goals. Why is she here? What does she want us to help her with? And then see, are they realistic goals? And we put that into perspective once we get all the information in. The validated questionnaires are very important, and we review each and every questionnaire. It's not something that you just fill up and we leave it in the chart. We actually go through every questionnaire with a fine-tooth comb. We do a proper and a thorough examination, as what I mentioned, standing up, and then appropriate testing also done standing up for the urodynamics. Once all this is done, then we come up with a correct diagnosis. This is all done at one visit. Within about 15 minutes or so, everything is over. And you understand exactly what is going on because I'm explaining to you as this is happening, and we can start the treatment right away. even if it is not a actual treatment. That means I'm not giving you a prescription, but the fact that you have completed the history forms, fact that you know what exactly is going on, that begins your treatment. Key part of treatment is knowing what the story is, making the correct diagnosis, and understanding the patient's goals. That is very important. Without having that information, I cannot come up with the proper treatment. For example, if a patient says that my goal is to be completely cured of urgency leakage, and she's a diabetic, she has heavy weight, I could tell her, no, I think we can get improved. Maybe you'll leak 50% less, but I cannot tell you that you'll be completely cured. And she says 50% less is fine. I'm leaking 10 times, 4 times a day. Oh, that'll be great. That I'll be satisfied with that. That is creating realistic expectations. So this all allows us to do that. Next step, what are you supposed to do? We'll have you watch the initial videos on the pelvic floor. So when you go to my website, right at the front page, you'll see me there. And I'll be talking about a little bit about these conditions, and then I'll guide you through that as to which video should you watch initially. So if you have stress incontinence, which is leaking with laughing, coughing, sneezing, what should you see? If you have urgency incontinence, what should you see, etc. You should then complete the history forms that I've talked ad nauseum, and my chart us that you have completed the forms. If you send it to us beforehand, icing on the cake. But if you at least tell us that you've completed it, Scouts Honor will take your word for it, and then we will confirm. Just let us know that you confirm your appointment in my chart. I confirm my appointment for date this, time this. Without this, your appointment remains tentative. Remember, it can get canceled. So with this information, completed history form, if you watch the video and your appointment, that makes it a definitive appointment. And then we will take care of you. And I look forward to doing that. Thank you.